COVID-19 is, there's a lot of mental health piece that gets missed. A lot of people focus on, the economic impact of COVID-19, but we see the mental health impacts on our side. And how do we make sure our staff are able to, deliver courageous conversation from a compassionate viewpoint? One of the greatest example that I can think of the importance of building trust between our clients and our staff is, we have a lot of people who are really in a bad place because of this COVID-19. And sometimes we reach them at their lowest, point in life, and they're at the point of harming themselves. The first suicide call that we had was when we had the first suicide prevention training. Talk about, perfect timing. Our staff that got that call, had the training, I think a day before or even a week before. It was just so relevant because our staff was so grateful of receiving that training and really using the tools that they learned, because it was really fresh, of first calling out, having that courage to say, are you thinking about harming yourself? Are you thinking about suicide? If they did, I don't know, I hate to say, what if, but I'm not sure if they had that training, had it been, had they been successful, because it's really, unless you have that suicide prevention training, you're not automatically thinking when somebody is like telling you of, I don't know if I would have been able to recognize what they were saying as a self-harming. Yeah, we had the training, and then now we're doing this 5-hour mental health first aid training, and I took the training. I really liked it, and we've been, because of the relationship, because of the linguistic and culturally appropriate services that we're doing, we were able, our contact tracers were able to stop some, our clients and contacts committing suicides, and de-escalated the situation, calmed the contacts, and said, I truly want to help you. Please don't harm yourself. What can I do? And stayed on the phone, and really just provided that human connection as much as possible over the phone, where the contacts was able to not harm themselves, but also forever be grateful to this contact tracer who not only stopped harming themselves, but also help them and ease their situation and connect them, not the resources to pay the utilities or get food, but also beyond, like a mental health therapist, and connect them with services and professionals that can help them, deal with the mental health piece that's coming up for them. But also we were able to also meet the resources that they need, because they were like just it was just overwhelming to handle, of all this challenges that were coming because of the COVID. And